Hello, I am Dr. DeAndre. Today I will talk about how sugar affects cancer growth, separating fact from fiction. This is one of the most commonly misunderstood topics in modern health discussions. Many patients believe that sugar directly feeds cancer and that eliminating it completely can stop tumor growth. However, the science behind this belief is far more complex. Cancer is not caused by a single nutrient or food group. It is a disease driven by genetic mutations, environmental factors, and metabolic changes inside the body. Globally, millions of people are diagnosed with cancer every year, and dietary advice often becomes confusing and sometimes misleading. Some sources suggest completely avoiding sugar, while others say it has no effect at all. The truth lies in understanding how the body processes glucose and how cancer cells behave differently from normal cells. In this video, I will explain clearly and scientifically how sugar interacts with cancer cells, whether it increases risk, and what practical steps you should take. My goal is to provide you with evidence-based information so you can make informed decisions about your health. Sugar, in medical terms, primarily refers to glucose, which is the main source of energy for the human body. When you consume carbohydrates such as bread, rice, fruits, or sweets, your digestive system breaks them down into glucose. This glucose enters the bloodstream and is transported into cells with the help of insulin, a hormone produced by the pancreas. Every cell in the body depends on glucose to function properly. The brain alone consumes about 20% of the body's total glucose supply. Muscles use glucose for movement, and organs rely on it to maintain essential biological processes. This means glucose is not harmful by itself. It is essential for survival. Cancer cells also use glucose, but they do so in a different way. They rely heavily on a process known as aerobic glycolysis, or the Warburg effect. This means cancer cells consume glucose at a much higher rate compared to normal cells, even when oxygen is available. This inefficient energy production allows cancer cells to grow rapidly and multiply. However, it is important to understand that this behavior is driven by genetic mutations within the cancer cells, not by the amount of sugar you eat. Even if you reduce sugar intake, your body can still produce glucose from other sources like proteins and fats through a process called gluconeogenesis. Therefore, glucose is always present in the body, regardless of diet. This is why simply removing sugar from your diet does not stop cancer cells from accessing energy. There is currently no direct scientific evidence proving that sugar itself causes cancer. Sugar is not classified as a carcinogen, meaning it does not directly damage DNA or initiate the formation of cancer cells. However, excessive sugar consumption can indirectly increase cancer risk through other mechanisms. One of the most important factors is obesity. High intake of added sugars, especially from sugary drinks and processed foods, contributes significantly to weight gain. Obesity is strongly linked to several types of cancer, including breast, colorectal, and pancreatic cancers. Research shows that obesity can increase cancer risk by approximately 20 to 40% depending on the type. Another factor is insulin resistance. Consuming high amounts of sugar over time can lead to elevated insulin levels in the body. Insulin is a growth-promoting hormone, and chronically high levels may encourage cell proliferation and reduce natural cell death. This environment can support the development of cancer, although it is not a direct cause. In addition, high sugar intake is associated with chronic inflammation. Inflammation creates a biological environment that may contribute to cancer progression. Studies have shown that diets high in refined carbohydrates and sugars are linked to increased inflammatory markers in the body. The key point is that sugar contributes to conditions that may increase cancer risk, but it is not the root cause. Lifestyle factors, such as physical inactivity, smoking, alcohol consumption, and overall diet quality, play a much larger role in cancer development. The statement, "sugar feeds cancer," is often misunderstood. While it is true that cancer cells use glucose for energy, this is not unique to cancer cells. All cells in the human body require glucose to survive and function. This includes healthy cells in the brain, heart, and muscles. If you completely eliminate sugar from your diet, your body will still maintain blood glucose levels through internal processes. The liver can produce glucose from non-carbohydrate sources, such as amino acids and fatty acids. This ensures that vital organs continue to receive the energy they need. Clinical studies have not demonstrated that cutting out sugar alone can stop cancer growth or shrink tumors. Cancer treatment requires medical interventions such as surgery, chemotherapy, radiation therapy, and targeted therapies. Nutrition supports these treatments but does not replace them. There has been interest in specialized diets, such as ketogenic diets, which significantly reduce carbohydrate intake. Some early research suggests these diets may influence cancer metabolism in certain cases. However, the evidence is not strong enough to recommend them as a standard treatment. These diets should only be followed under strict medical supervision. It is also important to consider that many cancer patients experience weight loss and fatigue. In these cases, restricting sugar and carbohydrates too much can lead to malnutrition and weaken the body. Adequate nutrition is essential for maintaining strength and supporting recovery during treatment. Although sugar does not directly cause cancer, excessive consumption has significant negative effects on overall health. High sugar intake is closely linked to weight gain, type 2 diabetes, and cardiovascular disease. These conditions can complicate cancer prevention and treatment. For example, individuals with diabetes often have higher levels of circulating glucose and insulin. This can create an environment that may support tumor growth in certain types of cancer. Additionally, high blood sugar levels can impair immune function, making it harder for the body to fight infections and recover from illness. Excess sugar consumption is also associated with metabolic syndrome, a condition that includes high blood pressure, abnormal cholesterol levels, and increased abdominal fat. This syndrome is linked to a higher risk of several chronic diseases, including cancer. Sugary beverages are one of the largest contributors to excessive sugar intake. Studies have shown that people who regularly consume sugary drinks have a significantly higher risk of obesity and metabolic disorders. Reducing intake of these beverages is one of the most effective steps for improving health. From a medical perspective, moderation is essential. Naturally occurring sugars found in fruits and vegetables are generally safe because they come with fiber, vitamins, and antioxidants. The main concern is added sugars found in processed foods and drinks. For cancer prevention and overall health, the focus should be on a balanced and sustainable diet rather than eliminating specific nutrients. A healthy diet includes whole grains, lean proteins, healthy fats, fruits, and vegetables. These foods provide essential nutrients that support the immune system and overall body function. Health organizations recommend limiting added sugar intake to less than 10% of total daily calories. For many adults, this means reducing consumption of sugary drinks, desserts, and processed snacks. Reading food labels can help identify hidden sugars in packaged products. Maintaining a healthy body weight is one of the most important steps in reducing cancer risk. Regular physical activity, such as walking for at least 30 minutes a day, can significantly improve metabolic health. Exercise helps regulate blood sugar levels and reduces inflammation. For individuals undergoing cancer treatment, nutritional needs may vary. Some patients require higher calorie intake to maintain weight and strength. It is important not to follow extreme diets without medical guidance. Consulting a doctor or registered dietitian ensures that dietary choices support treatment and recovery. Hydration is also essential. Drinking adequate water supports digestion, circulation, and overall health. Limiting sugary beverages and replacing them with water or unsweetened drinks is a practical and effective change. In summary, sugar does not directly cause cancer, and eliminating it completely will not cure cancer. All cells in the body, including healthy ones, require glucose for energy. Cancer cells use glucose more rapidly, but this process is driven by genetic changes, not dietary sugar alone. The real concern is excessive sugar intake, which can lead to obesity, insulin resistance, and chronic inflammation. These conditions may increase the risk of cancer over time and can complicate treatment outcomes. The most effective approach is to focus on overall lifestyle habits. Maintain a balanced diet, stay physically active, and avoid excessive consumption of processed foods and sugary drinks. These steps not only reduce cancer risk, but also improve general health and well-being. If you are currently undergoing cancer treatment or have concerns about your diet, always consult your physician before making significant changes. Medical guidance ensures that your nutritional needs are met safely and effectively. If you found this information helpful, consider sharing it with others. Accurate, evidence-based knowledge is essential in making informed health decisions.